So, Guy, it's so good to have you on Fempower Health. We met in 2020 when I had just started the podcast, and
Mhm.
you did such a great job in talking about the microbiome. And then you helped my son and I through some of his challenges. And so I greatly appreciate that because I trust your work and you're so passionate about the gut microbiome. I thought there must be a tie when it comes to our hormones. And so I really appreciate you making time to educate us based on what we know, which we know research is limited on women's health, but I know that you will tell us what the research says. So before we dive in, tell us all about yourself, and then we can dive into this topic.
Well, I just recently actually launched my own platform the end of February this year, so it's only been a handful of months. And the entire platform is centered around the microbiome and how it relates to various conditions that you might have, whether it's depression, anxiety, IBS, Crohn's, ulcerative colitis, what have you. And I have very, very technical, in-depth presentations both on my website, which is themicrobiomeexpert.com, and also on my YouTube channel. I cite everything I cite with scientific references. I even provide PMID numbers at times. And I have a different perspective. It's different from others. And it works because, over these many years, as the previous director of medical education for a microbiome firm and on my own, I've helped an awful lot of people where an awful lot of practitioners before them have failed.
Yep. No, and I can attest, like you were incredible to talk to when my son was struggling with some of his health issues. I've done a lot of episodes on the gut microbiome from various aspects, some of it from the diet aspect. I know a lot of people are talking about metabolic health. I've done a lot with vaginal microbiome as well. So I think a lot of people are really familiar and finally talking about this to the degree that it warrants. But for those who aren't really familiar, maybe you can just give us a quick summary on the importance of the gut microbiome, and then we can talk about how it relates to women's health and different conditions that we may face.
Sure. So when we talk about, the microbiome, we're usually referring to the gut microbiome. But there's actually a microbiome in every part of us, whether it's the mouth, the lungs, the stomach, you name it, the gut, the vagina, everywhere. And in fact, in one of my many presentations, I cite a study that found DNA from thousands of bacteria in our blood. So they're everywhere. They're all throughout our body. It's a whole nother genome. It's a whole nother ecosystem that we have to live with. And if we take care of this microbiome, then it will in turn take care of us. And so when it comes to the gut, and really the gut microbiome is really connected to the mouth, to the stomach, the small intestine, the large intestine. People usually think of just the microbiome of the large intestine, but they're all very well connected, as well as the vagina, and we'll get into some of these things as well as the uterus and so forth. So because these bugs move around, and they use what's called translocate, and so whole bugs or parts of bugs can go from one spot to another and cause problems in another location. So if we take good care of our microbiome, then it will do good things for us. If we don't, then we're going to create a whole nother environment down there where the bad guys, what are called opportunistic pathogens, they will then begin to take over and become opportunistic. And then they will thrive and they will do bad things. And I can tie a bad microbiome into just about every single health condition you can name. And some of these health conditions have a ton of data, like IBS and IBD and colorectal cancer and things like that. There's a tremendous amount of data or going over the past, say, 20 years. And then some things like our topics today actually do have less data, but we'll still be able to tie some stuff in.
Okay, good. Yeah, because I was trying to research some stuff to be able to reference things, and I'm like, wow, it's really tough to find the data. So I know that you're like a an encyclopedia of the microbiome. So I'm definitely relying on you today.
I try.
So one quick question too that I do want to address is I feel like it's people are simplifying it as the microbiome and its health is based on your diet. Is it that simple or is it more complicated than that?
Well, it's certainly more complicated than that, but the diet is one of the two or three main drivers of your microbiome health. So I literally have been through thousands and thousands of papers over the years, and as people watch my videos, they'll get an appreciation of actually how much data I've been through. The diet, it does play a huge role. There's no doubt about that. Everything you ingest affects your microbiome. And even your thoughts affect your microbiome. I just recently launched a presentation on anxiety and depression and the microbiome. And I have some really good, information there as well. So, everything, but especially food does affect your microbiome. However, probably more so than that are antibiotics. To me, antibiotics are the number one driver of the microbial health in your gut. I have a whole presentation dedicated to antibiotics in the microbiome. And, sure, one round of antibiotics, okay, fine. You're gonna bounce back fine. 2 rounds, fine, okay, whatever. But as time goes on, you're gonna take more and more hits. And the good guys tend to not survive that well, and the bad guys tend to bounce back very quickly and take over real estate. And so antibiotics is a huge, huge player. To me, the number one issue. And then when you get back into diet, when people have what I call a broken gut, where they're just a mess. I mean, they have, every GI symptom you can think of, anxiety, depression, blah, 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 the list goes on. Diet alone, in my experience over these many years, is not going to resolve those issues. You have to actually drive significant environmental shift through how I work. I work in a little different manner than everybody else. And so, sometimes, yeah, diet alone can help and get some results, especially people who aren't that really dysbiotic. But people who are a mess, and I've talked to, girls, women who've been on over 100 rounds of antibiotics in their life, which is just astronomical. And so you cannot fix that with diet alone. I will add the other huge component to this are PPIs, proton pump inhibitors for people who have GERD. I have a whole presentation dedicated to that as well. And they, without a doubt, negatively impact their microbiome. So there's a lot of moving parts here. But yes, antibiotics, number one, in my opinion. And then you probably, put in tied for number two, PPIs in diet.
Wow. Okay. I am not surprised. And actually I'm glad I asked this question because like I have, so many women will complain about UTIs and be put on antibiotics. Like that's a
Right.
common one I hear so much, especially in this perimenopause, menopause stage of life. And like I have one friend who is constantly on antibiotics. And every time I hear it, I'm like, oh, please don't tell me that you just got prescribed another antibiotic. Because I know from talking to you and so many other experts over the years that try to avoid it as much as we can. And so this is why I'm even more excited to talk about this because I feel like it is this one system and there are all these cores that we're forgetting about because we're trying to solve for these symptoms that keep popping up, but really there's a few core foundational things that we can do to stay healthy. All right, hormones and the microbiome.
Okay.
What do we know so far?
Well, I can tell you one thing that's really kind of key.
Okay.
Is that so in the liver, as everyone knows, the liver is responsible for detoxing a lot of, things out of the body. There's a pathway called glucuronidation. It's what the liver does. And I'm going to see if I can talk with my hands here. Okay, this is not too disturbing, is it?
Talk with your hands,
So,
and I'll make
all
sure
right.
to show
Well,
the video version on YouTube.
I'm half Italian, so if you tie my hands together, I can't speak. So anyway, so the liver takes, these toxins, okay? It could be a toxin from the outside world, or it could be something that we need to process within our body. And for the purposes of our conversation, we're talking about either estrogen or testosterone, okay? And it takes this glucuronic acid, it's a sugar, and it binds the two together. And so it gets excreted out, through the pancreas and into the duodenum, and then it's supposed to then be ultimately excreted either in the feces or the urine. However, what happens is when you have a dysbiotic microbiome, you have more bacteria that produce what's called beta glucuronidase, which takes that bond and just splits it. So now what happens is you're now reabsorbing either the testosterone and or the estrogen and or a long list of other toxins that are subject to this bond. You reabsorb them and they go back into circulation. So when we get into something like, let's say, endometriosis, which is an estrogen-driven condition, right, for cellular proliferation, then you're reabsorbing all those, estrogen metabolites, and then that was going to the serum, and they're able to actually continue to spur on growth of this endometrial tissue, which could be located in a number of different locations. Or if your microbiome, again, is absorbing maybe more testosterone, and we don't know all the details on this, more testosterone, that plays a role in, for example, PCOS, which is a more of a testosterone-driven condition. And so what is very, very important here to consider is that your microbiome is healthy enough to and this is always going to happen. There's always going to be breaking that bond. But it's a question of degree. How much are you going to break versus the person who does not have PCOS or does not have endometriosis? And to complicate things even further, and a lot of people have SIBO, small intestinal bacterial overgrowth. That is actually my most popular protocol. So when SIBO, you have bacteria that have crawled up, a larger number and different types of bacteria that crawled too high up the GI tract. And so now they're able to break those bonds sooner than if they were, say, further on down the GI tract, more in the colon, because they have crawled up into the small intestine. So again, you have this breaking of these bonds and this reabsorption of not only testosterone and estrogen, but a whole bunch of other toxins that you shouldn't be reabsorbing. So
Now
that is
I have a question though. You're using the word toxin for hormones. So
right.
I just
Well,
want to make sure I understand it. Is it more
from the
because it's being
body's
reabsorbed as opposed to, is that why?
well, from the body's perspective, in this case, the metabolites of testosterone and estrogen are toxins,
Okay.
right? So, but it could be anything from, I mean, there's a long list of these, like these outside world toxins that come in as well, or drugs when you metabolize some different drugs. So this pathway is a pretty common pathway that it processes a lot of different things. And so whatever that thing happens to be, whether it's a molecule from a drug, what have you, we don't want to be reabsorbing it.
Okay, got it. And then, okay, so I have to ask about endometriosis because this is a very strong community. I have endometriosis. It's why I had struggled with infertility. So I have to do justice to this community because what I do not want is someone taking a clip of this and saying, we now know the cause of endometriosis, or what is Georgie saying on her podcast? So what I want to clarify is, can you tell me more about what happens if the estrogen is getting reabsorbed, and like a little bit more about the endometriosis? Because I will say that there's still camps where some people believe they talk about retrograde menstruation. Others are saying, heck no. Many are saying it's very complicated. There's trauma, there's all of these other factors. There's still unknown factors. And so I'd love, from the microbiome perspective, can you just elaborate a little bit, given there's so many camps that have very strong opinions about this? Because this could be a very interesting angle that I don't know many people are talking about.
Sure, and I'm glad you said that because my perspective is the microbiome perspective. But I can also give you an epidemiological perspective as well. So those with endometriosis, they have a lot of IBS, much more IBS than your average bear, right? They also have a much higher level of anxiety and depression. And in a minute, I'll get into how those are all connected to the microbiome. And so if you go into the data, you start looking for the connection between endometriosis and IBS, say in Latin America or Asia or Africa, there's basically no data, right? So we'll get into the epidemiological data here. Whereas if you look at the United States, you see studies with the highest levels of endometriosis and the highest levels of IBS. And so this is not like, I think we can, because of that just basic epidemiological data, we can really just say, okay, there's something going on in the so-called advanced economies where, and this is true for, I mean, you name it, ulcerative colitis, Crohn's disease, autoimmune disease, everything you can think of, basically. This is true for, except for a couple little things, like weird infections. All these chronic degenerative diseases are much, much higher. The prevalence is much, much higher in North America and Western Europe. These so-called, and now nowadays more so in China as well. These so-called advanced economies, et cetera. So what's happening in these countries? Well, the diet has rapidly changed over the years. 40% of all meals in the United States are eaten in the car because people are on the go, so they're eating just absolute garbage. The use of antibiotics is becoming much spread more globally as well. But it's been very high in the United States as well. PPI is very high in the United States. So there's that particular component where you can go, okay, well, it's, is it genes? No, it's not genes, because if you look at advancing economies, not advanced, but advancing economies, then all of these chronic degenerative conditions are skyrocketing. So are people's genes changing this fast in all these conditions? No, they're not. The genes aren't changing. So what's changing? Again, this kind of the control of the system, right? Where it's like this so-called medical system with all the antibiotics and everything's drugs and surgery, as opposed to, hey, maybe we should eat better or something along those lines. So that's that side of the evidence. Now to come back to the IBS, the anxiety and depression, I think by now we all know that there's a large connection between your mental health and your gut health. And if you look at all these conditions with without a doubt, serious gut issues like ulcerative colitis, Crohn's disease, IBS, the rates of anxiety and depression in these conditions are very, very high, much, much higher than the average person running around. So, and I think by now your average viewer starts to know that the brain talks to the gut talks to the brain. In my presentations, I go in depth into how the inflammation that's really, to me, a lot of this is ultimately driven from the gut. And this dysbiosis drives inflammation, drives gut permeability, and then drives bacteria, parts of bacteria, to then go systemic. And in some people, that gift is something in the brain, whether that's, depression, anxiety, Alzheimer's, dementia, whatever happens to be. So for other people, it's an autoimmune disease. It's, something, Hashimoto's thyroiditis, or it's rheumatoid arthritis, or something like that. For some people, it's 3 or 4. They fall into the same bucket because everything is connected. So when we're talking about, the gut, endometriosis does not exist in a vacuum. You don't just magically, boom, get endometriosis. PCOS doesn't exist in a vacuum. There's a huge, huge correlation between a metabolic syndrome and PCOS. Are we just going to discount that? Or are we going to realize that, 72, 73% of the United States is either obese or overweight? And
Yep.
so these things, again, it's all connected. They do not exist in just a vacuum.
Right. So then let's talk about perimenopause. Now, with menopause, I don't know how we would have that conversation because, like, for example, if it is the estrogen, you're kind of done with estrogen when you've hit menopause. But in
Mm,
perimenopause, there's this fluctuation throughout a day and throughout weeks between the estrogen and progesterone, and I believe testosterone, and there's another hormone where everything is just fluctuating. But mainly people talk about the progesterone estrogen fluctuations. And, there
right.
are women who have varying degrees of symptoms. Some have
Mm.
horrific hot flashes. Some have severe anxiety and depression. People are talking about, do you know how many texts I get around? I suddenly have gained all this weight. I have changed nothing, but I'm in perimenopause. And,
Mhm.
we've, again, metabolic health, of course, I've done some episodes on that. So I'm very curious if there's some sort of a tie here with the natural changing of the hormones in this phase and the symptoms that women may have, like the degree to which they experience them, and gut health. Because right now, conversation is talk to your mother and your grandmother and your aunt and your sister and find out what their experience was. That's going to indicate what yours will be. Now I'm wondering if there's a gut health tie.
Well, so years and years ago, and I don't know if this is true, but years and years ago, I heard that in Japan, there's not a word for menopause. They just kind of, have you heard this? Does it ring a bell
I
to you?
have, but I've also spoken to an anthropologist who said they different cultures, they all have it, but they either
Mm.
don't talk about it or don't have words. So I'm curious what you have to say because I don't understand all this stuff with the cultures either.
So the impression basically I got from this very brief, snippet I heard was that clearly there's menopause, but I think they just kind of ease into it a lot more easily than say, their Western counterparts.
Right.
And frankly, there's really very, 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 very little data for the microbiome in perimenopause. There are differences between women who are perimenopausal and their microbiome versus those who are menopausal in their microbiome. So there are differences, but we're talking like 1 or 2 studies. It's are very, very few studies. But part of it, clearly is what we talked about before. But part of it too is just this overall level of inflammation. So you talked about metabolic syndrome. So I have a whole presentation on that's already been launched on obesity and type 2 diabetes. And so, there's a clear connection between the microbiome and those two conditions. And in fact, I do have to add that lactobacillus, if you all out there taking lactobacillus supplements, I frequently recommend against lactobacillus supplements. Yes, again, it's a different perspective, and you all have to watch my videos. I back everything up I say with tons and tons of evidence.
Okay.
So if you look at, for example, that presentation on metabolic syndrome and obesity, those who have both of those, one or the other, more often than not, when a significant difference is found in a study involving the healthy controls versus that particular cohort, the obese and or the type 2 diabetes have significantly higher levels of lactobacillus, one or more species, in their guts as compared to healthy controls. In fact, animals are given lactobacillus to fatten them up for slaughter. Animals are also given antibiotics to fatten up for slaughter as well. And what do antibiotics do? Change the microbiome for the worse. And who's also happy in the bad microbiome? Lactobacillus. Lactobacillus is also happy in the PPI microbiome. In presentation after presentation after presentation of mine, you're going to see that adding lactobacillus to the dysbiotic microbiome is a bad idea because the dysbiotic microbiome already has a ton of lactobacillus on board. Now, if you're a normal, healthy person, fine, you want to have some, kefir or whatever, okay, fine. In the healthy microbiome, it's fine. But in the dysbiotic microbiome, which these women we're largely talking about, these perimenopausal women, odds are they're dysbiotic. And if they think they're doing themselves good by adding up a whole bunch of lactobacillus, they may want to rethink that. And I have this in presentation after presentation. I talk about this more in depth in my presentation on pH in the microbiome. So that was just a little side tangent I took right there insofar as trying to rectify the microbiome. So let's go back to inflammation.
Right.
So the microbiome is going to, in the healthy state, is going to produce these things, among many things that it does, produce short-chain fatty acids. And these short-chain fatty acids actually have been shown, if we go back to endometriosis, to actually to retard, to inhibit the development of this extrauterine tissue from growing. So these short-chain fatty acids are not only present in the colon, but they also make their way into the serum, into the liver, and so forth. So systemically, they're a benefit. We typically think of them as for benefit. The colon, which butyrate is enormously beneficial. Butyrate is, to me, one of the two most important molecules in the human body. So in order to kind of take the role of the Japanese woman, kind of just easing into menopause, right? We have to take a kind of more of a holistic approach to this.
Okay.
And again, I say everything is connected. So if you are a 40-something-year-old woman who is now having these hormonal changes, maybe earlier than you should, because you're eating terrible food, you're never exercising, you're drinking too much alcohol, et cetera, et cetera, et cetera. You're eating terrible food, just junk food all the time and so forth. You're overweight, you're stressed out, you're unhappy, and again, your thoughts affect your microbiome as well. Then you're already walking into this already in an inflamed state. And I'm not talking inflammation like, a C. diff infection, which, by the way, antibiotics are the number one cause for C. diff infections. I'm talking about this low, rumbling, chronic level of inflammation. And this is what goes on to cause these other issues like autoimmune diseases and so forth. So I guess to kind of retrace my steps here, if we take more of a whole, because over the years, I've had so many people ask me magic in a bottle. Everyone wants magic in a bottle. I've had doctors say, Guy, you know what? I don't want to exercise. I don't want to change my diet. What supplement can you recommend for me to lose weight? And I've had, the old place we used to go to get my hair cut. The guy, I walk in, he'd be like, hey, doc, you know what? This arthritis is whatever is killing me. I tried this supplement. What should I try now? And I mean, he's overweight. He eats like hell. He doesn't exercise. And I'm like, don't do this to me. I'm like, you're looking for magic in a bottle. So I'm like a very anti-magic in a bottle person. I mean, when I have my consultations with people, I change diet frequently. Basically, almost all the time, I change some aspect of the diet. I certainly add a regimen that's going to address the microbiome. I add other components that might address, something that's kind of adjacent to that. Sometimes I talk about emotional health. For example, I had a consultation on Friday where, I've done just about everything I can, and this person has improved significantly. But the last steps are up to her, and I'm not going to get into details, but she needs to kind of like be at peace with things, and that's really the last piece of the puzzle. Like here's an example. So many years ago, I had this woman come in, and we talked for an hour. My consults are, they're always an hour. And at the end of the consult, I said, you know what? I said, your diet seems fantastic. Everything seems fantastic. I said, I have no magical, supplement regimen or diet to recommend to you. I said, however, I noticed two things in our consultation. Is one, I'm not telling you how to live your life, but it sounds like you live in a moldy house, and that could be a source of problems. And if I were in your shoes, I would reconsider where I was living. And I said, two, you repeated to me over and over again how you're in a toxic relationship. And again, I'm just, independent set of ears listening to you. And again, I'm not telling you how to live your life, but if I were in your shoes, I would reconsider, that relationship. So she comes in a month later. She's like, has all this extra energy. And before she was like really lethargic and blah, blah, blah. Had all this extra energy. She's like, I just took up surfing and blah, blah, blah. And I said, what the hell happened to you? She's like, I moved out of my moldy house and I broke up with my boyfriend.
Wow.
So, my point is we need to have a holistic approach to whatever's happening, whether it's this case perimenopause, whether it's someone younger with, endometriosis, or someone with, Crohn's or depression, anxiety, whatever it is. I'm not, I can get you so far, depending on what's going on with, this and that other thing. But again, it's not just, you can't buy one bottle of something, take one pill a day and expect for magical results.
Right.
So to go back full circle, if you are a 45-year-old woman who is obese, who's stressed out of her mind, who is unhappy, who's drinking too much, who's eating terrible food, you're already walking into perimenopause and behind the eight ball. So why would you expect in this pro-inflammatory environment where you're not going to process hormones properly anyway, and everything else is going on, you expect to just slide into menopause? So again, let's
Yeah.
take a look at the bigger picture.
Yeah, no, that's very true. So let me ask you this, and I can get detail oriented. So for anyone who's like, why are you asking this? Sorry, I just have to. What, like, how do we make this connection of, as we're aging? I think we talk so much about perimenopause and menopause being about the hormone changes, and we know that bone health, cardiovascular disease, all of these things we're so much more susceptible to as we age. And I feel like the conversation right now about this stage of life is hormone therapy, full stop, and really needs to be bigger than that. And I guess I'm curious, like, what is making such an impact on these symptoms? Because, and I don't know if I'm asking the question right, because it's I know it's complicated. I'm trying to figure out how to ask it without like leading the witness, but it's almost like you've got more stress because you're older. You've got kids probably going to college. In my case, I have a young kid because I started late, and there's a lot more on our shoulders. We're older. We worry about how we look or whatever, and now our body's changing. So I think there's all these foundational things. How could the gut microbiome and these hormone changes, is this just a big hot mess of all these things happening at once that exacerbates these symptoms? Did I ask it right? I wasn't sure how to ask. Does it make sense what I said? I hope it did.
Well, you definitely did not lead the witness. So I think I can go a lot of different directions with that, though. So first of all, to start with, if someone does want to do bioidentical hormone therapy, I'm on board with that. I have no problem with that. What I do have a problem is what the system generally offers, which is this other garbage. But if someone wants to seek out a competent practitioner who's experienced in bioidentical hormones, I have no problem with that. With that being said, you look at the longest lived women in the world, who are the Okinawan women. They don't do that, right? So they're living a different life. So if we visit those women, what are they doing for a living? And the longest lived men, by the way, are in Sardinia. So what are these men and women doing? Well, let's see. They have basically a zero stress lifestyle, right? They have home cooking. They're preparing their own food. They have fresh air. They have a community of people. These people are not triathletes. They're not bodybuilders. They're not Olympians. but they do walk. They walk up and downhill, and that's pretty much their secret. And if you look around to all these, these blue zones, and I've been to one of them where it's kind of the same thing repeats itself. You have, fresh air, whole food, low stress, moderate exercise, community relationships, clean water. And so, so what are, these, we'll just call them, I guess, US American women, what are they? They're lacking a lot of those things, right? And so, yeah. So let's go, let's talk about a couple of different things. So I recently had a consult with another woman who, she's suffering from a UTI. She has a strain of E. coli, and the doctors cannot kill it. They cannot kill it. And so one of the things that is common to your audience, I would assume, are UTIs. And so what's going on? And again, this is all connected. So where did this E. coli come from? It just didn't come out of nowhere. She didn't pick up on the street. She didn't pick up by eating a, tainted vegetable, right? Odds are it came from her gut. That's where most of these bugs come from. They originate from the gut. And so here we have a woman who had a long history of a terrible diet and lots of antibiotic use and everything else. And so when you have this pro-inflammatory gut environment, then the bad guys start changing their genetic expression. And I talk about this on a number of slides as well. And so they become more pathogenic. And so odds are is this E. coli may have very well been initially a regular old E. coli inhabitant, commensal inhabitant of the gut. But with inflation, it became more pathogenic. And then with more rounds of antibiotics, became antibiotic resistant. So they can't kill this thing. And but the approach there has been to kill, kill, kill. My approach is to nourish, nourish, nourish.
Okay.
So they can't kill it. So I'm trying to nourish the microbiome. So what was my point? My point is her microbiome, and we all have bugs going into our system. So in all my presentations, you'll see healthy controls versus somebody with something. And so, healthy control, they're going to have X amount of this bacteria, E. coli, or something else, some other bug in their blood. But the person with the condition is going to have significantly more. If you look at LPS is part of the membrane coating for gram-negative bacteria. It's generally an indication of gut permeability and presence of bad bugs. Again, healthy controls will have this much LPS floating around their blood. However, the condition, you name it, will have this much LPS floating around their blood. So what is LPS? LPS is very, very pro-inflammatory. And now your immune system starts reacting to the LPS or the whole bug itself or other parts of the bug. And this is a lot of what's going on. So again, I talked about inflammation before with the perimenopausal person, and I'm going to talk about inflammation again with the postmenopausal, woman. So what's heart disease? You talked about heart disease. It's inflammation, right? We have inflammation of the vasculature, right? So whether it's a stroke or whether it's a heart attack, it's inflammation of the vasculature. And I won't even get into, fat consumption and statins and everything like that, but let's just say there's huge question marks in that area. Okay. Let's talk about autoimmune disease. Autoimmune issues, are much more prevalent for women than they are for men. So that's relevant for our conversation here. I hear Hashimoto's thyroiditis all the time. It's endemic. I hear it all the time. So what's going on with all these autoimmune conditions? I'm actually in the process of launching a 2-part series on autoimmune conditions. Again, there are enormous correlations between the contents, the bugs in your microbiome, and gut permeability, which is, again, these bad bugs are they're adhering to and invading the cells that line the gut, and they're causing those cells to separate. And the contents from the gut go into the blood, and they wreak havoc all throughout the body. So, and one of those is, and you get into all these other topics of molecular mimicry and so forth. But in autoimmune disease, there's really 3 pillars to autoimmune disease. The most important pillar is the status of your immune system. Are you in a hyperinflammatory immune system, or are you in a tolerant immune system? If you have a tolerant immune system, then you're just going to fend off these little insults like, okay, whatever. I know that's a bad guy, get away. I know that's a bad guy masquerading as a good guy, get away. I know that's my own tissue. I'm not going to attack my own tissue. However, if you have this hypervigilant immune system, which is, again, a lot of these people in the United States and globally as well, really, where, again, with this, junk food diet, PPIs, antibiotics, et cetera, setting the stage for this. Then you have this, just like, it's like this, I'm always ready to fight. That looks like something I'm gonna fight it.
Right.
And so now you have this confusion of what's a bad guy and what's a good guy. And this is true for type 1 diabetes, type 1, the insulin requiring diabetes, right? It attacks the beta cells of the pancreas. It can attack the thyroid. It can attack your connective tissue in your knee or some other joint. And so, of the 3 pillars of autoimmune disease, that's the most important one. So yes, there's a genetic component, and yes, there's a molecular mimicry component, but again, it's that inflammatory, that hyperinflammatory component. That's the one that really, kind of sets the healthy controls apart from the autoimmune patients.
Right.
So, long roundabout way of answering this is, I guess, for these menopausal women who walk into an array of health conditions, you really need to walk into it as healthy as possible, as low in low inflammatory status as possible. It's like aging, okay? So I tell people all the time, as you age, it's important to walk into aging with as much muscle tissue as possible, because you're going to lose muscle tissue and you're
Right.
going to lose bone as you age. So what you want is a better starting point
Okay.
once you get into, say, your 70s, because then you have a better glide path as compared to someone who just never exercised at all and is just going to fall off a cliff quickly.
Okay. So is this almost, so it's more as we age, if I have this right, as we age, generally speaking, risk of having all of these different things happen to us increases, and therefore it's even more important for us to be healthy. Granted, we should be healthy from the get-go, but it's even more important to monitor. But then the hormone changes are almost an added layer. Is that, can we look at it almost like as those layers? I mean, it's probably way more complex, way more interconnected, but if we wanted to simplify it, it's like baseline be healthy. As you get older, you're at greater risk of things. Oh, by the way, in perimenopause, your hormones are fluctuating. That's going to add to things. And so if the base is not in great shape, everything else is just going to get worse. Is that a fair summary?
I think that would be, yeah. And in
Okay.
fact, and by the way, our microbiome ages as well. So there are clear, well-established differences between the microbiome of, say, a 70-year-old versus, say, a 30-year-old. And this is another presentation I have, is Healthy Aging in the Microbiome, where I did a complete meta-analysis, including centenarians, people, who are in their 80s, people with sarcopenia. And so, comparing those various populations against each other, there are, and I'm kind of hesitant to bring up some of these names, but I'll mention one name. So the superstar of the gut is Faecalibacterium prausnitzii. Okay, that is without a doubt the superstar of the gut.
Okay.
And so that particular bacterium, which on average comprises 5% of the microbiome, is significantly reduced in those with, say, sarcopenia, or significantly reduced in those who are frail versus the non-frail.
Okay.
Okay, so that's one of a number of very, very amazing health promoting bacteria that is reduced with age. But we can feed that bacteria. We can feed it because it likes certain fuels. Okay, and it doesn't like, for example, protein. All right, so people like, right now there's this huge fad for all these high animal protein fat diets, and I'm not in agreement with that. And if you look at the longest of people on earth, we go back to these men from Sardinia, the women from Okinawa. They're not eating 5 chickens a day. So they're eating a balanced diet. I eat protein. I love animal protein. But again, like, everything shouldn't be 100% protein. So
Yep.
we can feed the great bugs, the F. prausnitzii of the world, the roseburys of the world, the ruminococcus, all those. There's a long list of great bugs. They pretty much come from 3 families, and they like prebiotics, and basically everything you throw in your gut's a prebiotic, but from a certain class. And it's these sugars that are broken in bonds. Once again, we get back to bonds. That bonds that we cannot break with our own digestive enzymes, but bonds that these bacteria can break further on down the GI tract. And then we feed them. And this is how we can feed them with food. I use an awful lot of prebiotics when I'm working with people, and I use them in combination because it's a bad idea to use one prebiotic. And I use them at proper dosing to drive significant environmental shift. So for those, of you listeners who are concerned, okay, I want to age well, I'm concerned about osteoporosis. And by the way, your osteoporotic health is also tied to your microbiome. One of the things that a healthy microbiome does is help you increase calcium absorption. So there's one facet. Another facet is, again, inflammation. Okay, bone health is a function of inflammation. Oh, another thing I should add, since I mentioned the lactobacillus before, dairy products are not a good idea for osteoporosis. So I have, in my book that I wrote many years ago, I had a huge chapter on this. There are hundreds and hundreds of authors and scientific papers that come to that same conclusion. So is there calcium in dairy products? Yes. But there's also a lot of sulfur in dairy products in the methionine and cysteine, which are both amino acids. So you're actually having a net loss of calcium. So what happens? And I talk about this in my presentation on pH and the microbiome, is the pH of your blood remains very, very constant. If it doesn't, you're dead. So, there's none of this like I'm drinking lemon water to balance my pH. That's nonsense. Okay. So what you need is,
sorry.
I mean,
You're the best. You really are the best. Okay.
I'm just, listen, don't shoot the messenger. I'm just telling, I'm an encyclopedia of data. So don't shoot the messenger.
I know.
So what you need is you need to properly balance the things that tend to drive you to an acidic balance. So as soon as you go acidic, boop, you're not going to get very far. The body's not going to get very far from you're going to draw calcium from the bone, boop, to keep you right at that pH. Okay. So it's a very fluid process. You're not going to notice a difference. So, but over time, if you're eating, say, all I'm eating is steak for a living, or steak and yogurt, whatever, right? Then all the sulfur, all these methionine and cysteine are coming into the body. So you're constantly drawing off the calcium from the bone to neutralize that tendency to want to go acidic. Okay, and so they actually call dairy products, they call milk liquid protein. That's what they call milk, liquid protein.
Yep.
So we know high protein diet is not good for bone. Okay. Like the Eskimos. Okay. The Eskimos had terrible osteoporosis. When all these Eskimo heart studies they were doing, they had terrible osteoporosis. So, you have to have a diet that's, going to balance things up with vegetables are great. So again, if you're a menopausal woman concerned about osteoporosis, first of all, you have all sorts of problem with dairy. It's a draw on your bone health. So, and on top of that, it's the worst offender. Your overall health. It's full of antigens that you can react to. So if you look at my presentation, ulcerative colitis or on autoimmune diseases, if you have a dysbiotic microbiome, there are certain proteins and peptides from dairy that are highly, highly immunostimulatory, and you can react to those, and they look like some of your other proteins in your body, and you can cross-react to those, whether it's autoimmune disease, for example, type 1 diabetes, what have you. And this is just beyond lactose intolerance, because everyone thinks when they think about dairy, they think lactose intolerance.
Yeah.
That's a whole other issue. I'm talking about the proteins themselves, the amino acid sequences themselves. And for example, I'll give you another story. So years ago, I was helping this woman, and she had ulcerative colitis. And like everyone else I work with, she'd been to see about 10 other practitioners. And she came to see me, and I put her on my program, which is, dairy-free, especially for ulcerative colitis is dairy-free, especially. I put her on a dairy-free program, along with other things. After 2 weeks, she made a mistake, which, people new to programs, they make the mistakes. It happens.
Yep.
So she went out to dinner, she had a salad, and on her salad, she put on some cream-based dressing, some dairy-based dressing. Now, she had been doing great for 2 weeks. People were going, oh, you look fantastic. You're putting on weight. She hadn't had diarrhea the whole 9 yards. After this one event of a little bit of cream-based salad dressing, she had bloody diarrhea for the next 3 days. So that's the only difference.
Yep.
So again, you have this situation where, these women, they think they're doing right because the system tells you that the system with vested interests in the dairy industry says, consume dairy. They're not right. And so just eat, I don't know, Swiss chard or broccoli or almonds or things that are good for you to get your calcium, or even take a little bit of calcium here and then with the calcium pills, which I will also note, if you do a whole bunch of vitamin D and a whole bunch of calcium, you should definitely take vitamin K with that, because studies actually also show that people who do way much calcium actually have more coronary events. And if you put a bunch of vitamin D on there on top of that, you're just absorbing more calcium, so you have more calcification of soft tissue. So if you're going to be doing a whole bunch of D, and I see a lot of people taking way too much D, and I don't like all this crazy D levels. You're going to take a whole bunch of D with a whole bunch of calcium. Make sure you're taking vitamin K.
Wow. Okay. Holy cow. Okay. So, by the way, I just have to say this, and I'm always self-conscious to bring up examples of what I'm doing, because sometimes, I don't know, I just feel self-conscious, but I'll bring it up and people can do with it what they will. But I started this podcast because of my 4-year journey with infertility, which started in 2010. So I'm 14 years into knowing my body and learning, because I had to do all the research. And during that journey, I had to change my diet because the 10th doctor, who finally figured out why I couldn't get pregnant, he said, "You've got endo and no gluten or dairy." And I remember having a long debate with him. I'm like, "Can I have this? Can I have that?" Nope, nope, nope. All gluten, no. So I have been gluten-free for at least 10 years now, I think. I will say, like, learning from you and all these other experts, I will say that it is amazing the impact of cheating. That actually, more than cheating. When I just turned 50, and I was in California, and I was like, "Oh, I'm gonna go drive to Big Sur for the day," and I ate all this stuff that I normally do not. And for 3 weeks, I just could not feel okay. Like, everything was off. I don't even know how to explain it. It wasn't anything specific, but it was just my digestive system, headaches, everything was off. This weekend I went to the US Open with my son. I had fried food. Biggest mistake ever. I'm like, how do people live on this? I had it once
I know.
and I
Yeah.
thought I was going to die.
Yeah.
It is true. Like, because I can see now that I eat fairly clean, it is amazing the impact of, like, when I'm not sleeping, when I'm not eating right, just, it's unbelievable. So I echo everything you're saying. And also, my perimenopause symptoms weren't that bad. Now I've hit menopause, but yeah, it really ties together.
Yeah. I mean, if I can remember all these points that you brought up that I could think of to comment on.
There are so many I didn't realize.
No, I thought of at least four. So one, no, seriously. So, all right, one, you said you had to educate yourself.
Yes.
And it's due to people like, you and others, because I've been saying this for years and years and years. You have to educate yourself. And many people know their condition better than their doctors do.
Mhm.
And they certainly know their bodies better than their doctors do. And so you have a vested interest in your health. And again, not a big system guy. And so the system has a vested interest in you staying ill.
Yes.
And doctors sometimes are wonderful, sometimes are terrible. They are very, very confined in what they can do. They're living in a system that's they're working for groups. They don't want to get sued. They have to follow standards of care. They're only taught drugs and surgery. So the general conventional medical system as it is pretty terrible. I mean, that being said, if acute care is really good, you break your leg, you go to the
Yes.
hospital, they're going to do a good
100%.
job.
Yep.
So that was point number one: is educate yourself, and the best way to do that is online. There were some wonderful people saying some intelligent things. That being said, there were some people saying some stupid things as well. That was point number one. Point number two is when I'm in the grocery store, I look around at the people in front of me, behind me, checking the checkout line, and I'm going, my God. And I look at my food, I go, this is awesome. And I look at their stuff, I'm like, how are you alive?
Yep.
And I don't know how people do it. Point number three is I have Crohn's, and so I trust me, I feel your pain, and there's certain things I can't eat, and if I do, then problems arise. I manage my Crohn's basically flawlessly for all these. It's been over. How old am I now? It's been like 25 years now.
Okay.
But I developed my system over the years, so I really
Right.
perfected it about 10 to 15 years ago.
Okay.
So I feel your pain. But I also want to add that, and I guess this is point number four, is that in avoidance, in the beginning of taking care of someone, avoidance is part of the regimen. And it could be part of the regimen forever. Like, for example, the avoidance of dairy proteins. So, but there are a lot of people out there who paint themselves into a corner because they're like, okay, I react to this, and they get confused, and I don't know which one I reacted today. And they're left with either like white rice and chicken. And I've had people like that,
Ugh.
or just a couple of things more than white rice and chicken.
Right.
And so That's not a place you want to be. But they're reacting to everything. Why? Because they are hyper-inflammatory. Their immune system is ready to jump at a moment's notice at anything. It's just amped up. Why is it amped up? Because you have bad bugs in control of your microbiome. You're not properly taking care of the good ones. So as I rectify the microbiome, as this inflammation subsides, and as we have a more tolerant immune system, then we can start widening the diet. And I've had a number of people say, "Oh my God, I'm so happy I can eat A, B, and C again." And so these people are thrilled they can go back to eating certain foods that they hadn't been able to eat for years.
Right.
But again, it comes back to inflammation. So I think if there's a common theme here about anything,
Yeah.
it's the immune system and inflammation is really what drives a lot of. We could have a conversation on any health topic, and I can bring it back to that.
Yeah.
And where does that come from? That's driven in large part by the microbiome.
Yeah. No, it makes so much sense.
There are a number of studies for endometriosis and for the microbiome. So there are differences in the fecal microbiome in endometriosis versus healthy controls, the vaginal microbiome, the cervical microbiome, and the microbiome of the peritoneal cavity. And so, again, like I said, the bacteria they can translocate, they can move around. So, when you have like bacterial vaginosis, that could have come from the gut. When you have a UTI, that could have come from the gut. Well, guess what? There's also thinking that from the gut to the vagina, cervix, etc., you have, and studies show this. Studies actually also show more E. coli in the serum of endometriosis subjects versus healthy controls. So you have this E. coli, which is the poster child for bad bacteria,
Yep.
working its way into the uterus and into the peritoneal cavity. Not just the whole bug itself, but also its LPS. It's throwing off LPS, causing this pro-inflammatory environment, which is then, driving this. Who knows, what the prevailing theory of the day is with this retrograde, menstruation or what have you. But again, you're looking at a pro-inflammatory environment there, and there's a lot of data to back that up.
No, that makes sense. One point I did want to address, and I always like to say this when we talk about diet, is for anyone who panics and is listening to this, they're like, I just want a pill. I don't want to change my diet. I just want to say this. I went through a 14-year journey now about understanding what to eat, and I was absolutely resistant. And now I feel so amazing that I am not willing to pay the price of feeling bad by eating crappy food. I cheat. I eat a cupcake. Please do not get me wrong. I'm not like never eating sugar or anything like that. Once in a blue moon, I'll have wine, things like that. But like feeling good, it's like you look at the bad foods and you're like, yeah, I don't even care. It's not even tempting because you feel so good. And so you're so used to eating well that it's not tempting. So for anyone, just please understand if you need to go on this journey of changing, it can take time and you can do it slow. Or if you're all in, like probably many of your patients are, then fine. But I just feel like at the end of the day, to feel good, it's just amazing, honestly.
No, I completely agree. Fantastic. I mean, I haven't had a soda since I was 15 years old, so it's just, and you're right. These things are not tempting at all.
Yeah.
And my weakness is wine.
I do have to ask this question before we close, because this is another thing on all these discussions on perimenopause and menopause is bioidentical hormones. Okay, you said that they're okay and that the other crap you don't like. Can you just address that? And I'm so scared what everyone's going to say, but just tell us from your data-driven perspective what you meant by that, please.
Well, okay, so it really comes down to, I guess, how a pharmaceutical company is going to be profitable. So, pharma companies can't make a patent in general, the vast majority of the time, on something that's naturally occurring. So, whatever it is they're administering, in this case, a hormone, they have to kind of throw an extra group, extra compound on there to make it patentable. Okay. But then that changes the function, that changes the characteristics of in this case, a hormone. Bioidentical hormones are trying to replicate exactly the quantity and the type of hormone that you had previously at a younger age. And that's just kind of it in a nutshell. And so, um, And if someone doesn't want to do them, I completely agree. If you want to, like age gracefully or whatever, however you want to call it, I completely agree. I get it. But if you can also, if you also want to live a what I call a robust life and continue doing the things you want to do. For example, we can take sexual health. Okay, here's another topic we can talk about: sexual health in postmenopausal women. Okay, so with a lack of estrogen comes vaginal dryness, right?
Yes.
And so I have helped women in the past with simple natural medicine to help resolve that issue. But you can resolve that with bioidentical hormones as well, which those bioidentical hormones can also help with your bone health. And also, going back to the vagina, they will help with the pH balance in your vagina, okay, because of the estrogen, lactobacillus bad in the gut, but good in the vagina, by the
Yep.
way. So they'll help with the lactobacillus. That keeps the pH low in the vagina at about 4.1, 4.2, which is where you want it to be. That keeps the bad actors away, such as the candida and the bad bacteria, helps with your vaginal health, and then potentially helps with your UTI health, UTIs as well. So there's a lot of gains to be there. So if you want to, again, live robustly and keep, for example, an active sex life or what have you, or if you're physically active, you want, healthy bones, then I understand that. I'm on board with that. If you don't, fine, I understand that too. But then you need to be, probably even more cognizant of your lifestyle if you're not going to do that, and to protect your bone health and so forth.
Okay, perfect. I just didn't know if this was going to be a discussion around the compounded hormones versus the pharmaceutical products, because I know
Well,
that's a big
yeah, I started
discussion.
that way. That's what I said is the pharma stuff is basically kind of not good, right? It's synthetic, patentable stuff. And the bioidentical stuff is replacing what you had at that
Right.
type and that level.
Right. But
So,
okay, so let me ask you this then. If someone really wants to do the bioidentical and not the pharma, how do they know? Because the big controversy that the clinicians talk about, that I've interviewed and on social media, is how do you know that it's done properly? It's not consistent doses, et cetera, et cetera. I'm just so curious on your perspective on this.
yeah, so I think 2 or 3 or 4 years ago, there was a lab that was doing compounding that some bad things happened.
Okay.
But I mean, I can't cite statistics on this,
Okay.
but from what I know, the vast, vast, vast majority of the cases, these compounding labs are doing a good job.
Okay.
I think this is part of it is like sowing fear into people. It's kind of like when I'm helping someone and they go and see their conventional doctor and they say, "Well, I'm talking to this scientist guy and he tells me to do this." And the doctor's like, "Oh, no, no, hold, no, 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 don't do that. That's just stupid. That doesn't, et cetera, et cetera." So it's like, it's things they're afraid of or things they don't know or things that they're afraid of because they don't know.
Right.
And so, you know, is there a chance that a compounding pharmacy is gonna, you know, make a mistake somewhere? Yeah. Do pharmaceutical companies make mistakes in manufacturing? Yeah, there's documentation on that as well.
Yeah.
It's
That's so
you have to you
interesting.
have to you have to consider who you're listening to.
Right.
Okay, I have no vested stake. I'm not a compounding pharmacist, and I have no holdings in any pharma companies.
Right.
So I'm just simply giving you my honest opinion. I have no
Okay.
vested interest.
Okay.
So you have to consider the source.
Yeah. No, that's very interesting. Yeah, I don't have an answer either. Also with supplements, I don't even like people ask questions. I'm like, I have no answers. I don't know how
Mhm.
to differentiate. I'm not going down that road. not not
That
not
we
doing
could do.
that. So let's summarize. At the end of the day, the gut microbiome has a huge impact on our overall health. And you gave us such great examples. And I think having that as a great foundation just really helps our overall health. And then we layered on all these wonderful things that happen to us as we age with our lovely hormone changes and whatnot. You need to have a protocol for us women, Guy, but I know it's probably personalized. So how do we come after you and like have you help us? What do we need to know?
Well, I do have protocols. So I have two different
Okay.
I guess modalities, I guess. So one, I offer protocols for individual conditions. So whether it's IBS diarrhea, IBS constipation, anxiety depression, what have you. Those are on my website under the tab protocols.
Okay.
And my website again is themicrobiomeexpert.com. And so that's part of it. The other part is if you want something more individualized, then again on my website as well, you can schedule a consultation with me and we'll talk for an hour about whatever's going on. And during those consultations, I follow the same format I've followed for years, is I just get the person to start talking because, whoever's has the problem, whatever's going on, they have the answers. They have all the information for me. I just need to listen and just connect the dots from, someone who's had a lot of experience, someone a tremendous amount of research, someone who's designed trials, run trials, very successful trials, by the way. Um, just to listen, and then the last 10 minutes, I kind of do a wrap up, and I say, okay, this is and I ask defining questions through. I'm like, can you explain that better along the way? And then the last 10 minutes, I'm like, okay, this is what I heard, this is what I think should be happening, and then I'm going to send you a protocol. I'm going to type you up a specific protocol for you at some point in the next 24 hours, and you follow that. I have a very open email communication where for people who are working with me, they can just email me. I don't charge for silly little things like that. And so, because everyone always has questions, like I found this supplement. Is this good for me to buy, or do I take it this at this dose, or can I mix this with this, or can I eat this? So there's always questions. And
Right.
by the way, I have no vested interest in any supplement companies either. So the products I recommend, I don't sell anything. I don't sell products. You just buy them online. And sometimes they're very generic, but there are supplements that are rather specific. And my goal is to get people better as quickly as possible. Again, I still have Crohn's. You never get rid of it, but I manage it fantastically over these many years. And so I've been in these people's shoes. So that's what makes me so passionate about what I do.
I just really appreciate you making time to talk about this. I know we need so much more research in women's health, but I do believe the foundations that we do know seem to apply. And so I hope
For
people
sure. Hmm.
really take our conversation into account for their own health journey. So thank you so, so much. This was wonderful.
Well, thanks for having me.